I am Dee Whisker. I live just north of Elkton. I am a retired nurse of 32 years. I worked at the Brookings Hospital all those years. Now in my retirement, I sew, I quilt. It was on my regular yearly checkup. I didn't go in for anything special. There was no problems. And as she was listening to my heart, she noticed an irregularity. The first EKG was over at the clinic because it was done right away that day. And she got the results. I had PACs, which is premature atrial contractions. We need to figure out what's going on, and we need further studies. So made appointments here. It didn't take that long to get an appointment. It basically takes a picture of your heart so it can see how it's contracting, how the little valves are working, if they're opening and shutting properly, how the blood flows in and flows around in the heart. It had a picture of what's going on when my heart is throwing the PACs or PVCs. The stress test, we could either else do it, I'm going to say physically, walking on a treadmill, and I thought, I don't know. I had hip replacement a few years ago. It's still giving me some problem. Didn't know if I could, walk as long as they wanted me to. So she explained what we were going to do. She says we can either else do it, the physically way, walking on the treadmill, or use the medication. And she says, I will order the medication so I have it on hand. So the morning that I came in for the stress test, she told Dr. Johnston, I do have the medication on hand. She isn't sure if she can walk on the treadmill as long. And he says, well, let's just do the medication because we get a better picture with that anyway. And they told me, the possible side effects, what I might feel using the medication, and what to expect. And there were at least 2 people in there, if not 3, monitoring me. And they says, if you feel anything or if anything, you have problems, let us know right away. Yep, it all went like it was supposed to. After it was all done, of course I couldn't have anything really to eat or drink. I could have drank water, but I couldn't have coffee, and I love my coffee. They introduced themselves, let me know what's going on, what to expect, if I had any questions, if I understood everything. They wanted to make sure that I knew what was going on and what to expect. I don't know, I trusted them. Nothing that needs medical attention. So it's just kind of okay, we're gonna watch this. And, treatment as far as, what kind of medications I'm on, what might cause more of them, and coffee is one of them. Just, if I notice anything, if I can feel my heart pounding, or if I really notice irregularity in my heart rate, if it's bothering me, let her know. Otherwise, we're just gonna wait on it and see how it goes from there. Oh, yes, because otherwise I would have known, well, I have an irregularity in my heart. What's going on? Is this gonna happen? Is it gonna, is my heart gonna keep working the way it's supposed to? If you catch it early enough, it's easier to treat instead of letting it go. It's close, it's trustworthy. If there is something beyond their capabilities, they are not afraid to say, hey, we need to send you to Sioux Falls.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.